audio should be working now, and thank you so much for letting me know that I did not have my audio functioning correctly. So we should be getting some comments about the audio working now that I've hit the button and made it come through. I've taken away all of the warnings that I'm not doing it correctly, so you guys should be able to hear me. I'll go back to the comments and get caught up on. Okay, there we go. Brianna can hear me now. Thank you, Brianna. Good to know. And the other people who are watching, good to have you here also. So have any of you either had hospice or do you have questions about it? If not, I'll jump right into describing our experience over the weekend and tell you that it was a very good experience. I'll say that. I mean, it's not a good experience to lose your loved ones, absolutely, but it was made easier, better because of having hospice involved, and we really appreciate them. Specifically, we had Hospice of the Foothills out of, I believe, out of Nevada County, come down and help us. And that's who was contracted with my parents' insurance to supply hospice, and did a great job. Before I jump into it, let me check real quickly again to see if there's any comments we really want to address. Oh, yes, thank you, Brianna. Diane can hear us, and Rena's here. Rena, thank you. Rena, of course, is a part of the story because the funeral of my father is actually on the day of her wedding. Sorry, Rena. So we were not able to fly to Houston to attend Rena's wedding, but we hope it goes wonderful. Just sorry we can't make it. And oh, Maggie I is going through hospice with her father, and Lori Bell is asking about hospice, so we're going to get into that. Maggie I wants me to call her Lynn. Okay, Lynn. And Rena, thank you for your understanding. We really appreciate that. So hospice is a way to go through the dying process when it's inevitable without what would happen a lot of times before we had hospice, where every time there's a change in the patient's health status or decline, they're taken to some kind of healthcare provider or the emergency department, and tests are run and treatments are given to try to optimize the treatment of whatever this underlying disease is that we know is going to kill the patient. This is when a patient is known to be terminal, or they are going to die within the next 6 months roughly. And honestly, I'm a doctor, so I know how this goes, and I can tell you it is a guess. Sometimes we are wrong. Sometimes we have patients we put on hospice thinking they probably won't be with us in 6 months, and 2 years later they're still living, and we're being a blessing to their family and not going. Other times we'll try to get hospice set up and just barely in time actually get it set up, which there's some elements in that with our story. Let me get caught up on comments here as we continue this discussion. And yes, thank you, everybody. So hospice, when you're making a decision that we are not going to get past this terminal illness, it's not going to get better, making a decision to treat your patient to make them comfortable, keep testing to a minimum, and just give medicines that address symptoms as symptoms, not trying to get to the source of it, just making them comfortable until they die. And then trying to make it the least traumatic you can, make the dying process on the patient and the family. All right, we have a comment from Brianna. I know someone who was on hospice 2 years ago, and he's still here, but he's gotten worse now. Yeah, and that's usually the case, that if there was a reason to put them on hospice, even if they didn't die within that 2-year period, that they're probably in a state of decline as far as their health. The hospice usually will provide medications to the family, provide things like hospital bed and oxygen, if that's helpful, provide teaching, lots of education in the home with the family, education specific to what they're going through, because it's one nurse or one family for the nurse right there in your home, asking you questions, you asking them questions, and taking you through the process. And Brianna says the person she knew has cancer, and it's spreading everywhere. Oftentimes it's cancer. In our case, it was dementia. They provide medications and teaching in the administration of these medications. One of the things that people who don't know about hospice are concerned about is pain in dying. Oftentimes people aren't afraid of death, they're afraid of dying, which can be a painful process. And hospice is set up to get the right medicines in the hands of the family to be able to administer the patient themselves according to some instructions to help their loved one through. And, you know, it takes a special person to be able to do this. And I'm talking about at-home hospice. There's also inpatient hospice where you can actually have professionals, mental health professionals, medical assistants, and nurses' aides and nurses giving the medicines and helping the patient along. In our case, it was at home. My brother and I were the ones who took over giving the medicines, took over for my mother so that she didn't have to do that. We were able to keep track of the medicines and keep track of how the symptoms were going and treat it appropriately so that my father was not in pain. Getting caught up on comments. Rena says, from my experience, I feel having hospice involved early for my ex with stage cancer, it helps improve quality of life. The patients actually live longer than having them involved last minute. Yes, absolutely. Brianna says, I see a lot while working in the nursing home. Yep. Max asking what happened. Lurabelle, my grandfather was in hospice for 3 months and we had him another year. We lost him 5 years ago. Kelsey, topic close to home tonight. Cheers from Montreal. Thank you, Kelsey. I hope that this is helpful for you. And I already forgot what Maggie I told me to call her. My dad had CHF, uncontrolled diabetes, heart failure. Horrible to watch. Thankfully, I had experience in the medical field. Oh, Rena's example, not her ex. Thank you, Rena. I was starting to wonder, is there a whole social history that you have that I have no idea about? So example, that's clear now. Sorry for the misunderstanding there. Yeah, the medications can include morphine. They can include benzodiazepines, morphine being an opiate that we talk about in another sense in many other videos as far as it being a problem with people in chronic pain who aren't on hospice. Not a real good place for it, but in hospice, morphine is very good and can be used according to how it's needed to make things better for the patient. In our experience, my father was having some breathing symptoms because of the dying process and his organs shutting down. And also there was some pain coming from something else that was concomitant with his illness that was killing him. Morphine helps. You can dose it. You can increase the dose quite a bit as needed by the patient. If you give a whole lot of morphine, you can actually affect somebody's respirations, and even somebody can die from respiratory depression from the morphine. So you don't want to give that much, but enough so that the symptoms are addressed. And that's exactly what we were able to do. We did not have an effect on breathing, but we were able to get the symptoms controlled, get kind of a schedule and find out what dose to give. And I'll admit this was a little bit easier for me being a doctor and knowing how to dose things and how to watch symptoms and how to come up with a dosing schedule based on how the patient responds to morphine. So it's kind of nice that my brother and I, we were able to do that. I don't know that every family would have a lot of ease in doing that, but that's the great thing about hospice. You can call them up, tell the nurse, hey, my loved one seems to be in pain. We're having difficulty with managing it. Could you come and help walk us through how we should be dosing this medicine? And they'll talk to you about how they respond to the doses you've given and the timing you've been using and help you to not have your loved one hurting. Okay, getting caught up with comments again. Mac Dodge's uncle actually passed away last Tuesday. Brianna McMillan's, thank you. Or she's saying sorry to Mac. Yes, Mac, we are sorry. And Meg, yeah, exactly. Breathing, it helped. The morphine helped a lot. And for the shortness of breath. In our case, we're giving liquid morphine in the mouth. It's absorbed by the oral mucosa so that it can take effect when you aren't able to swallow pills. And of course, in hospice, the idea is we're not doing invasive medical interventions, so you don't have an IV in the patient for administering something like morphine. It takes effect within 15, 20 minutes, and you can see them start to improve. And the situation can, in many cases, involve pulmonary edema, where the lung is not keeping the fluid out enough, or the heart is not pumping the fluid of the blood through the body enough to keep it from building up in the lungs. And so there's actually a drowning process that takes place, which can be very disconcerting to family members. even with good treatment of the pain, that the process is still occurring. And it may not be easy for a lot of family members to experience. And in our family, we went through that. It was hard. Not everybody's able to be there. And thankfully it worked out that those who could were, and it was still hard. It brings to mind the physician-assisted suicide argument, which people think of for somebody dying, but really doesn't apply to hospice, at least not the way the law is written in California, because it has to be a person who is competent to make a decision to go into that. So that may apply to something like cancer pain. But in our situation, even though it's an awful thing for the family to go through, with the morphine, you're able to and benzodiazepines too can be used with that. You can medicate the patient so that even though they're going through a terrible process with their breathing and they're going through the dying process, they're not hurting. In our case, our father was not conscious, and you're able to get them through. Morphine helps the patient. Doesn't necessarily help the family who is witnessing what's going on with the patient's body. So again, I would say it's not for everyone to go through that process with their loved one. It can be disturbing. And having seen it for myself, I understand now when people come back and say it was not easy to watch their loved one die because of whether it be pulmonary edema, CHF, or some other end process that may be more disconcerting in its appearance to somebody on the outside than the patient who's unconscious because the morphine's able to relax them enough that they're not awake. Okay, getting caught up on comments. We have Rena saying, also hospice doesn't mean you have to stay on it. You can get it on supportive measures and things get better, get off as well. And we have patients who graduate from hospice is the way we term it. And we're so happy for them when that happens. And it happens on occasion that a patient does graduate from hospice, and maybe they'll get back on it later, at a later time. Brianna's saying that's what happened with the guy I know. Talking to Rena, got okay last part of the year. Lori Bell, which is better, hospice or a nursing home? You can have hospice in a nursing home if they have hospice beds. In our experience, we were so glad to have my dad in his home, and we were in the home when he died, rather than having to be in a strange place and then you have to drive into this place with visiting hours, or maybe even a roommate in the bed next to them while they're dying, and then people walking back and forth in the hall. I'm so glad we didn't have to go through that experience. I'm so glad we were able to do it at home. We were close. We were close to trying to get him into some kind of a facility that had hospice beds, and we're so glad that didn't happen. But we were also blessed with my brother and myself, because it happened over a weekend, being able to spend those 3 nights in my parents' home, right there with him, going through this process. If it had lasted longer and we needed to work, we would have really been in not so good of a situation. So hospice would not have been, well, it still would have been hospice. It's just we would appreciate it being in a facility if it hadn't happened. Perfect timing on the weekend for us to be able to help out. Oh, BooBoo Kitty's here. Hi, BooBoo. Trying to get caught up with your comments and questions. Hospice can go to the nursing home too, but I think some hospices that are working in the nursing home, seeing it every day, I'd say at-home hospice. BooBoo says depends on the amount of care they need. And that's a big factor too. You have to have family members who are able to do a lot of the care. Even though you can have the nurse coming in, you can have them come in quite often. They came every time we asked them to with us, and wonderful nursing care. Hospice can go to the nursing home too, but I think hospice home better. Okay, and then BooBoo says depends on the amount. BooBoo's asking if she missed the stream. No, what's going on right now. And E. Wooters is talking to Lori Bell, saying it's a very personal choice. I've been through hospice with my mother, and it was wonderful. And I would agree that's my experience too. I also work in a nursing home, and it's difficult for me to see folks who don't have family. Awful thing to not have family. Be good to your family. Be good to your family. It is what we're supposed to do. And I encourage everybody to do that. Audrey says her mother-in-law had hospice in a nursing home. And Maggie, we got my dad out just in time, 2 days. BooBoo, there's hospice and then there's palliative care. Generally, palliative care is what you call it in the hospital, whereas hospice is more outpatient. That's just a generalization. Somebody may correct me and say that's not exactly right, but that's how I view it. BooBoo's saying it's also helpful if the family can administer the meds. and not everybody can, not everybody has, for one thing, and the inclination to track the numbers and the milligrams and the milliliters and to draw up things into syringes and to keep a log and to watch the symptoms. That's not for every family member. We found that to be the case in our family. Yeah, my brother and I were good with it. And by good with, I don't mean we're excellent. I mean just that we're okay with taking on that role. And we have family members who weren't. And yeah, if you don't have somebody in your family who's able to take on that role, then hospice at home may not be the best. Maybe you will want to be in a facility. And thankfully, you can do it in a facility. Okay, and BooBoo's saying, no, it isn't. Well, BooBoo, tell us the difference there. And thank you so much for your comments, everybody. We'll wait and, of course, give BooBoo a chance to give a little bit of differentiation there between hospice and palliative care. Palliative is referring to just treating the symptoms, not trying to cure, which is also what happens in hospice. I did it so the others wouldn't have to. I did it so. Rena, there's also supportive care such as yoga, music therapy, massage therapy, acupuncture, et cetera, that can help in the palliative way. Absolutely, those would be part of palliative care. Not that you can't have them in hospice, but yeah, palliative care. Lori Bell saying we don't have enough time to get my aunt mom in time out of the nursing home. We lost her last minute, so sorry, Lori Bell. Magpie Eye. That's what I had to do, all the care with meds. Oh, you had to do it too, Magpie Eye? You had to, and I'm sorry, I forgot your name. You told me what to call you. Thank you so much, guys. Talking a little bit about the channel. We had an exciting event last Friday at the high school, the anatomy and physiology class, where Dr. Gwain did some cryotherapy on the tip of this ear, and also right here, those of you who saw it may want to see an update, follow up on how this is healing. You can see it's kind of blistered there, no pain at all. It's just healing up from the cryotherapy. And I'm going to put some sunscreen on these spots before I run, and I am much more wearing hats with brims, like a boonie, ever since my cryotherapy procedure, because the risk of skin cancer, having had some precancerous lesions, is much more real to me, just like hospice is much more real to me after a family having gone through it this weekend. Okay, here we go. Here's BooBoo's comment. Palliative care is when the person is still seeing the doctor. Hospice is end stage. Audrey saying, can't imagine being a hospice care employee. Whew. Hospice care employee. Yeah, we had a nurse, her name was Amanda from Hospice of the Foothills, a nonprofit hospice here in our area. And I just can't say enough about how great she was in the way that she ministered to our family at a time when my dad was dying. Amanda, if you ever hear this, thank you, thank you, thank you, thank you, thank you from me, from my brothers, from my mom. Thank you for what you were to us. Worked at hospice. It was heart-wrenching. I can understand it was. Reading comments here. And BooBoo, I meant before I did the meds so the rest of the family wouldn't have to. Yes, if you're in a family that is going through hospice, if you can take it upon yourself to be the one that's there, that's doing the medicines, please do. That would be such an incredible service to your family, and very rewarding in a kind of a backwards, strange way, because losing a family member is not a reward, but to have that knowledge that because of you, they were able to stay in their home, family was able to be there in the home. It's a really good thing. Okay, Audrey, wonderful. It has to be heart-wrenching and sad to hear the news. Thank you, appreciate that. And BooBoo says, and when I said no, it was in reference to your statement, it's not easy to do the pain meds for a loved one. Oh, that's what she's talking about. Not easy to do the pain meds for a loved one. That's, yeah, it's unique. You give medicines to patients. Once your loved one's a little bit different, you kind of have to change this role from doctor to son or brother, in our case. Update on the channel. We are getting a lot of weird things going on with YouTube. They're not putting us up as often for suggested videos. So numbers have dropped because of that. And they're also not letting us monetize things we used to be able to, again, because of whether it's advertiser friendly or age appropriate. You guys saw a previous video about that. And although we may agree with the people who make those decisions in YouTube, there's really no getting around it. YouTube's where the audience is, so that's why we put things here. We also put things on Amazon. So if you search for Auburn Medical Group on Amazon, you can actually see some videos there you can't see here. One in particular is one of our most popular, the one with the older gentleman who laughs so much and has earwax removed. That has been blurred on YouTube, but there's a link in the description so you can watch it on Amazon. So we're kind of pushing some traffic over there. And from a creator standpoint, it's much more rewarding to put things on Amazon, but you're not able to have all the comments, so you don't have that engagement. So it's not as rewarding in that sense as far as the personal side of it. Oops, sorry, didn't mean to move that. See Under Fire says, I'd go in one day and see patients, and the next day go in, they had died. I would cry every day, but it felt good just helping being their family patients. BooBoo says, did a family member die, Dr. Vaughan? Yes, my father died yesterday. Got here, missed most of the chat. Wooters, hospice is definitely a calling. Not every healthcare worker is cut out for it and considering transitioning to it. Oh, good, Wooters. Audrey says, I've noticed some videos are posting not appropriate for anyone 18 years of age. Audrey, I think you're over 18, so you'll still be able to watch them. But yeah, they are doing that, and it's a little frustrating because you're not able to monetize them. And you know, I was kind of helping make this happen, so makes me want to especially thank the patrons out there, like BooBoo and many others. We also have Lindsay Graff and Meg Lightbown and Petra Rosenberg. Thank you, thank you, thank you for making this. And then we list another list of people who are giving in the description of just about every video. Tia Chia, I do hospice, it's beautiful. Thank you, Tia. BooBoo Kitty, I'm so sorry, all right. Are the kids doing okay? We're all right, we're doing okay, but thank you, thank you, thank you. Tia Chia, I'm glad your family was able to have that experience. Sorry for your loss. So thank you, thank you. Yeah, now it's, you know, the whole funeral memorial service process that we're having to get organized, which, you know, after you go through that, you'd kind of like to have a break and not have to do all that, but it needs to be done. Teresa D. Press for your family doctor, thank you so much. Audrey, friend, your family and friends are in our prayers. Thank you, Audrey, appreciate that. We'll go ahead and wrap up here. There won't be a produced video for tomorrow at 4, although we're doing a live video now. And then hopefully this week procedure will come in between now and Friday at 4. So I'm hoping to have a good produced video that we put out at 4 o'clock on Friday. We didn't last Friday because we did the high school cryotherapy here and here at 1:30 in the afternoon on Friday. And that video is up and available for people who want to spend a long time watching us talk to high school students. And then Teresa D for the prayers for our family. Thank you, appreciate that. BooBoo, much love to me and LeeAnn and the kids. Thank you, thank you, thank you, thank you, thank you. You people are so thoughtful, and the prayers are appreciated, and then the comments. And we'll go ahead and take a break now. Thank you so much. I'm gonna go spend some time with my mom now. And until next time, Dr. Mark Vaughan telling all of you, thank you, and stay in good health. And I'll figure out how to stop this. How do you stop the live chat? Okay, see you guys.